take the tape off, place it onto this table. This table is our sterile space. We don't want to mess with this sterile space. Okay. I can make it easy. No, you're good.
I can see it too. Oh, okay. Yeah. Love you too. I'll just airdrop.
Okay. So when looking at your sterile towel, I'm going to show you how to fold this too. Folding is not part of check off, just like bed making, but it helps set up for you or the next person. Because there's this little tab. I'm going to stand at the head of the table right here. The little tab is pointing towards me, so all I do is pull away. I know it's hard for y'all to see, but where's that next tab pointing at?
Right.
Pointing to my right. You're good. So with my right hand, I pull it off to the side. It's pointing to my left now. I pull to the left. You just follow it. The reason why I don't want to cross with my right is because we still want this to be sterile, or the towel might be exposed and we don't want to cross over exposed packages. So just follow the points. Last point's pointing towards me. Pull it down. Okay? So this is sterile, but my hands are what? Sterile or not sterile? What are they right now? Not sterile. But I can pick this up and I'll show you why in a second. You see how this has a tab right here? I'm going to pinch on right here in the middle of that little triangle. So I'm going to pinch and it's pointing to the left. I'm going to use my left hand. I'll slowly lift up until I see the other corner. I'm going to pinch here. I'm going to lift up and then shake it loose. So which side is sterile and which side is not sterile?
Away from you is sterile.
And the side I'm touching is not sterile anymore. That's why I can touch it, because this is still sterile. Does that make sense? I'm not pinching it on both sides. I'm pinching on just one. Make sense? Okay. So I'm gonna move this table back a little bit. I'm gonna come all the way forward. Come out. And then when it touches the table, I just ladle. That's it. You don't want to come from the front, because then you risk dragging it and then laying it on. Best bet is just come off this side and lay it down. Be careful when moving the table back, because if you do have a little bit hanging off, you don't want it to touch the table. Make sense? If you need to move the table, I would suggest just putting your foot at the base. Pretty good mobility. Last thing for sterile, you have an imaginary 1-inch border. You just have to picture it in your mind. We deem as not sterile. Yes, it is sterile, but we want to say it's not, because you still have the table right next to it, and if something falls on it, we don't want to run the risk of having an infection, right? So just pretend that there's an imaginary 1-inch border. So this white cloth is your sterile field. This green is not. Okay. Next is your sterile basin. Same thing. Just take your tape off. The best way to hold this is underneath the pointy flap. The basin has this curve, or this little lip that goes all the way around it. The basin is also kind of like a bean shape. You want to hold it in the kind of concave side. Underneath, there's this lip like I was talking about. You grab that lip, and I have good mobility with it. I'm not going to drop it because it is slippery. So if you hold it like this, it won't slip. You want to hold it in the hand opposite of the table. And I'll show you why in a second. So take the flaps, same thing like this. You just pull away, and most of the time it'll completely unflap. But you just follow the little arrows. I don't want to cross over the basin, so I'm going to turn it this way. And just pull it flat. And then the last one, just pull towards me. The reason why I'm holding it in this hand is because I want it on the far side of the table. I use this hand when I want to place it right here. Where's my elbow over? It's completely over my sterile field. So you hold it in the opposite hand. I come over, a good little 1 inch above, 1, 2, 3, drop it in. Simple, easy, cool.
Would that towel end up like going to the biohazard or no?
You just place off the side.
Okay.
Okay, so my basin's empty, I need to fill it, so that's how you know it's your next step. You want to do this next so that you minimize how much water splash on any materials. There's no materials on here yet, so I'm minimizing how much water splash there could be. Because this is still cloth, right, or paper in the hospital. If you get any water on here, it can come up from below the table. Even though we sanitize it, trying to minimize those risks. So like with any of our materials, we're checking the expiration date, we're checking the integrity of it. You want to hold this up to the light, make sure nothing's floating in it, because this can be reused. Most of the time the nurses before will just leave it off this side table. So when you open it, your best practice is to just pour out a little bit into the trash. The principle is it cleans off that edge that you're about to pour it on. Make sense? So then you come over with your left hand, just a few inches above, pour a little bit of the same hand. I don't use my right hand here, same principle. Why? Move my sterile field. Just close it, put it off to the side. So next step, 4x4s. This is the one that I was kind of telling you about why you want to keep your packaging. We have plenty of gauze, just not more packaging for y'all. Okay. So when opening these, I also have a hard time. My best advice is to completely open the top. So rip the top apart, get a good grip, and let it back and forward motion. Open it up. We want to get this as flat as possible. I kind of switch my hand grip, and we want you to pop it onto the field. We don't want to let it slide onto the field because there's an adhesive. You see that blue tape, that blue adhesive around the packaging? You can't let it slide onto that. So it's kind of popping motion. 1, 2, 3. Pop on. Okay. Kind of imagine a line going up right here. Just pop it on. Throw these. It's easier to throw. And just drop it from waist height. Okay, same thing. There's a flap at the top. Start across the top. Get a good grip. Locking motion. Back and forth. Come over. A lot of y'all like to start high. You don't have to start too high. You can come a little lower. Just pop it in. Remember, you want it outside of that 1 inch quarter. So, for example, just showing y'all, if it would have fallen closer to me, that's on my 1 inch, or easier for y'all to see. It's on my 1 inch. Really, your two options are to just leave it and not use it. Mr. G, I only brought 3 of those packs in. I need another one. But this is when you probably would want to have brought extra into the room. I'm not saying grab the whole supply closet, grab 1 or 2 extra. Same thing with sterile gloves. I have 3 packs here. I might want to grab just 1 extra or something. Okay. Or your other option is you really don't want to leave your field, but you can come around the edge, grab it if you can, and pull it off. But your best bet is just to leave it.
When you pop it onto the sterile field, you don't want to pop it on the other material? You don't want to stack?
You can. I'm just not that good at getting it to stack.
I didn't know if you it's harder to work with if it's stacked.
No, you should be fine because we're following the principles of it. You'll have gloves on in a second and you'll be able to manipulate it like you want to.
Okay.
That'll be fine. Good question. But you're fine because you can allow everything to still touch each other because this is still all sterile. And the last one. Across the top. Get a good grip. Pull across. Like I said, a lot of people where they messed up is they won't finish pulling it and it stays a little attached right here, and when they go to pop, it just stays caught. And just get close to the table. 1, 2, 3. Pop on.
During the checkoff, if we do like mess up on one, can we grab the extra one and save ourselves, or?
I'll probably realistically either get one more for you to practice with, or I'll just place it back onto the thing for you and pop it back in. It will just be more of an imaginary stance, but that's good because, good question. In practice, you know, we all messed up, right? So it's for you to recognize during checkoff. Thank you for mine. It's for you to tell me I broke through, because you know how I kind of talked that last time? This time for checkoff, I'm really not going to be talking. I'm just going to be watching. If you break something like very blatantly, then I'll try to point it to you and I'll ask you to pause so you can recognize it, because I don't want to get to the end of the checkoff and I didn't even see that. I don't even think he sounded true. I want you to see where he messed up, but most of the time I'm going to be quiet and I'm just going to let you go through this process. So if you recognize that something fell out, don't just stand there. Tell me that it is. Because if you do, then you tell me how do you fix it. Either A, I try to take it off, B, I leave it, and then especially what, I get another one. Does that help?
Thank you.
Yeah, we can all mess up, but it's how do you fix it, and I need you to recognize it. This is the heavier one. This is that big abdominal pad, 5x9. It has that little lip at the top too. Same thing, break the top across, and then just pull back. So there's two sides of this. I'll show you in a second, but you just plop it on. Your best bet is to keep this one especially low, because this one likes to roll a lot, and just plop it on. But what I want to show you have this opaque and clear side. I prefer to have it on the opaque side because it just flops right back on. Some people prefer the clear side. It's up to you. The clear side, it does cradle a little more, so it gets caught for me. But practice both ways. It doesn't matter. Just get it on there sterile. Okay? Okay. So your Q-tips are next. Same thing at the top. Have a little flap. You just pull back and open it up. You don't want to open up these the whole way, because we're going to designate this top of the stick as not sterile anymore, but the rest of the stick is still sterile. Okay. So you place this in between your pinky and your ring finger. And then you can open up multiple packages and have them held right here, in between the pinky and the ring. Why am I doing that? Because I'm going to hold the ointment. Yesterday was a brand new one. Make sure it's not a brand new one. Okay, we're good. I'm going to hold the ointment in the same hand. I'm going to be careful. The only thing you really be careful of is that this doesn't touch the bottom of the ointment. So I'm holding it all in this hand so that I can manipulate it with the sun. You know how for the saline, we poured a little out to make sure that we cleaned off the rim and kind of sterilized the rim. You want to do that with this as well. So somebody's used it, obviously. So what I want to do is hold one last thing. The cotton, you don't want to touch the rim. You want it just to touch the ointment. You don't know what else has touched the rim. So this top bit of ointment, I squeeze kind of at a vertical angle, trying to catch it. Pull towards me, and I throw that first one. It cleans off that top piece. So the next one.
And you always say, if it's a maybe, do you want a maybe with your grandma, or do you want to push it?
Kind of twist and turn with it sometimes. First one, where I'm touching is not sterile, so I lay the rest of what is sterile onto the sterile field. Make sense? Remember, I have still that 1 inch imaginary border, so that amount of Q-tip that is sterile shortens even more. But I have a good bit into that sterile field. So you want 2 with ointment, because our wound is vertical, so there's 2 sides of the wound. So I like I said, squeeze this at about 90-degree angle, kind of whip it. put the next one onto the dip. Just pro sterile. Can't drop your hand. Arms getting the rest of it. And then you always leave one that doesn't have ointment, just to help spread if you want to spread. And then I still have another pack if I need it. So you don't want to just leave this for the next person. So your best bet, take your Q-tip packaging, finish opening it. The rest of this inside is still sterile. Nothing's touched it. And I just wipe it. Makes sense? Okay. So before I put on my sterile gloves, you want to expose your patient. So ask your patient it's okay to pull down their blanket, it's an imaginary blanket, and then you have your dressing that you're looking at. Observe the outside of it, see if it's any drainage coming on the outside, if it's full or any odors, things like that. So when you're taking this off with non-sterile gloves, this is when you put on your non-sterile. This doesn't have to be put on anyway, just put on the non-sterile gloves. Your best bet is to, with one hand, kind of loosen the tape around the dressing. And then with your other hand, try to do as best as you can. Grab everything. Before you take a step back to throw it, you need to do two things. You need to look at the wound. What am I looking at for the wound? Drainage, color, amount. Is there any odor to the drainage? Where is it coming from the wound? If it's coming out. How does the wound look? Is it closing up? Is it separating? Is it well approximated? Is what we call for when it's getting close together and healing. And then lastly, how many staples? So, drainage, how well is it closing up? And staples. Makes sense? Then you can take a step back and look at the dressing itself. What a lot of people get to look at is the dressing, because you're going to get back to your computer at your desk. You're going to have to chart about what you found. You're going to forget what you saw for this, or you're going to say you just didn't even look at it. So your best bet before you take a step back is to remember to look at the dressing itself as well. Same things: drainage, color, odor, amount. So you're going to ball this up as tight and nice as you can in one hand. When taking off gloves though, taking off gloves is the same. It's always glove to glove, skin to skin. So your best bet to grab for your glove is about right here, right above your wrist. Grab, completely pull over the dressing. Then skin to skin. So one of your fingers go underneath the glove. It's a little tighter. Wrap it in. Touch the patient, just drop it into bio. Cool? So, before you put your sterile gloves on, you can put one glove or two gloves on. It really doesn't matter. I'm just going to put on one pair for right here. You're going to have 2 fingers for each side. So, pinky and ring finger and index in the middle. I have 2. Why am I doing this? You're going to want to palpate each side of the wound. And then with the other 2 fingers, a rolling motion down, you're palpating, you're feeling for any masses, any tenderness, any warmth. And while you're palpating, look at the patient's face. So it's just the outside of the wound. I'm not pushing on the wound, I'm pressing on the surrounding skin. And then you can take that glove off. Good. Okay, the fun part.
Can I step closer for this?
You can do it.
Can I get closer for this?
So for gloves, you know how we pop everything onto the field? You don't need to do this with your gloves. Gloves are in a separate packaging. You just come and place your gloves onto this side of the field. Remember how I said I was setting things up in a specific way? It gives you as much room to work with on these tables. That's not picking it up. Okay, so you can open up your package. And opening up your package, you have a bottom flap, a top flap, and the middle. I want you to open up the top and bottom first. So fold those back and smooth out the crease. Try your best to not let it touch your sterile film, even though you still have that 1 inch border, you don't want it to touch. Now that I have the tops opened up, I can do the middle. For the middle flaps, it's kind of like French doors. You have to pass your fingers underneath. And it creates kind of like a piece to grab onto. And there I grab in the middle. Give it one good pull. And it stays open. I have 2 more of these that I'm going to do, and y'all can get up closer and watch too. Okay? So which glove am I putting on first? Dominant. So with the dominant, it's going to be hard for y'all to see. I'll get y'all to stand up for the next one. But you're going to grab from the glove. I prefer to grab a little closer up to where the opening of the glove is. And when you're pinching the glove, try not to pinch the part of the glove that's the thumb underneath. Because if you pinch the thumb as well, you won't be able to get your thumb in. So just be mindful where you're pinching. You're going to pick up, move to the side. And when you place your hands in, not part sterile, you can't pull your hand out. I just want to show you. See this rim where the end of the cup is? Once your fingers get past that, I want you to fan your fingers out, and it helps line them up. Fan your fingers out and then finish sliding. It's almost like a 2-part. Put your hand in. Once you get past, fan your hands out, fingers out, and finish putting in. Cool. Next step, you want your thumb to hold your pinky down. You can only use these 3 fingers. Don't pinch. You can only use these 3. You're gonna put these fingers down onto the fingers of the glove. I know it's hard for you to see. The next one I'll do. I'm gonna just show you the gist of it. You're gonna slide your fingers. Crap, I have it on with the glove. Give me a second, guys. There you go. You're gonna slide them into the cup. And all this is sliding the glove, your hand into the glove. Same thing, once you get about halfway, span them out. The reason why I want y'all to have the thumb holding your pinky down is because when you don't, and you hold it like this, you run the risk of touching your own skin. So hold your pinky down with your thumb, and it holds it away from your forearm. And you let go. Makes sense? Okay. So my hands are now wet. So I can touch what? My sterile field. You can do 2 things. First thing I like to do, remember these come in packs of 2, right? So I'm going to take 3 of these dolls and I'm going to place them into my saline. While that is soaking, I can take my 5x9, place it downward. Did y'all see how the blue line was on top? That's that blue line y'all saw. Look on the other side. No blue line. So that's how you know that this is going to go on the bottom, because we're going to put more gauze to wick up any drainage. I take 1 4x4, place it on the left, another one, place it on the right, making a nice little bed for it. And then the last one, you kind of open up, roll, kind of fluff up. The reason why I'm rolling it and fluffing it up, look at the wound. It's long and vertical, right? I don't want to just ball it up and put it in the middle. You want to make it as long as possible so that when it lays onto the wound, it can help wick up anything. It provides more surface area for that wound to get drainage out. Just kind of fluff it up, put it in the middle. It doesn't have to be anything too perfect. Okay? So my hands are still wet. Sterile. So the next step, this has been soaking. I'm going to pick the ones that have been soaking in saline up. And I don't want you to squeeze from your palm to wring it out. You need to squeeze from your fingertips. I'll show you in a second why. So keep your fingers in. Just kind of squeeze out the extra saline. So if I squeeze from my palm and upward, look what happens. Right? It just sprays everywhere. Keep it in your fingers, in the dish. It's a lot of steps, guys, but once you do it once, twice, it just becomes second nature, and you start recognizing why you do these things.
Would, if you did that, would that become unsterile, even
Yep.
though it's in sterile figures?
No, you're good. So you have to do what? Most likely restart if it touched your packaging or if it touched your gauze. Because even though the table is sterile, now the towel's wet, what could come up if it wasn't completely sterilized? So you have to restart. For that be for you to recognize that you spilled, and I'm just gonna mark, and if you don't tell me something, just have to check off, right? So I have 3 gauze here. Hands are still what? Sterile. As soon as I touch the patient, they won't be sterile anymore. What do I want to wash first? You want to wash or clean the wound first. So dirtiest to cleanest. So I'm going straight down the middle. When I'm cleaning the wound, I'm not cleaning like a bed bath. It's one motion downward. Kind of a rolling motion. I'm keeping it in a little ball and just one motion down. A good swipe. I just clean. And then I throw. It's the wrong bag, but it's fine. That'll happen. So grab the next one. Opposite side of me of the wound. One motion down. Does that make sense why I'm not hitting up and down? And then the side closest to me. So my hands are now what?
Not sterile.
My hands are not sterile now. So what am I doing next?
Changing it.
It's a trick question. There's one other thing I can do. Look at the table. What is left that's not sterile? I can touch the Q-tips because my hands are now what? Not sterile. So I can grab the edge of the Q-tip. The rest of it's sterile, right? Just the tip that I didn't touch. And you're putting it on the edge of the wound in a rolling motion down, just like with the gauze while cleaning. You can't pass it back and down. So I'm gonna grab the other one, and on the side closer to me, smear it on that side. Okay. If you have a big part that wasn't smoothed out, that's why I have the extra one, and I can just smooth it out. But I can't do it on both sides. I can't do it on up and down. I can only use it for one, just like everything else. One motion down, and then I throw. If you need another Q-tip, my hands are what? So what could I touch? I could grab my packaging because my hands aren't sterile anyways. You just be careful, same thing. You only open it to a certain amount and pull out what you need. Okay. I'm gonna leave this for one of y'all for extra if y'all want. So my hands are not sterile. How do I take this off? I'm gonna pinch right here, glove to glove. A pinch here, out forward. Keep your fingers tight in, and then hold it within this glove and keep it contained. And skin to skin. So underneath the glove, pull over. That's fine. Good. So for your second set of gloves, I like to personally, you don't have to, but to keep things contained, I like to fold this one up. Especially if you have the time. Now I have a new surface to put my next one on, so I'm not trying to wrestle with 2 papers underneath. So grab the second. Like I said, you don't have to worry about popping it into the sterile field. Just take it out, place on. So if y'all want, y'all can get a little closer. Or if half of y'all want to get closer, then I can do it again for the next half. It's up to y'all. Whoever wants to come. So when you open this up, they have a top and they have a bottom. So for these, like I said, I like for y'all to completely flatten out the top and flatten out the bottom. You want to be careful that you don't touch this middle piece. Why? That's where the gloves are at. So just kind of stay on the edges, flatten these parts out. Then underneath, they have this middle tab, kind of like window panes or French doors. Get your fingers underneath, and you can grab. One good pull, and it stays open. So I just touched this, right, and it's on the inside. So y'all see this fold? Yeah, I just folded in on the top. This little column and on this side, that's okay to touch. But any closer, don't touch. Just don't even risk it. Just put it down. So I'm gonna grab my dominant first. You see how the thumb is closer on this side? So I'm gonna pinch right here on the cuff. I'm gonna move over. You want your elbow up. You want your thumb facing forward, because that's where the thumb is at, facing forward. So when you place your hand in, once you get past the little rim, fan your fingers out and slide them up. Okay. Reason why I want my elbow up is as soon as you pick your hand up to try to put your glove on, the fingers that aren't in yet, they flap back and they'll hit your wrist. Keep my pinky down by using my thumb. If you feel this is sliding a lot, grab where you had opened it up. I want these two fingers on the fingers of the glove that's not used. I'm using my index finger to help lift the cuff up. Does everybody see that? Okay. Same thing. If this isn't open, you can kind of pinch just at the top to help open it up. Hand is open, it's fine. Place your hand in, get your thumb. I'm gonna make this one, I could fix it, but I'm not. I'm gonna show you why. So my hand doesn't touch, my thumb comes nowhere near it. If I was pinching on the wrist, that's why we're gonna do this. I place it on. Oh no, it's not fixed. You just fix it with your glove. Don't try not to pull too far below the wrist, because then you can slip. Just always pull from the top. About wrist up. Cool? Okay. So what's left? Just placing it on. So my hands are what? I can grab what? That is sterile. You can grab it. Don't be afraid to. Okay? I'm actually gonna flip this up just a little bit more. You can grab it. You want to contain it. You don't want it to be floating around. That's why you can grab it. And all you do is just come, place it on. And that's it. Cool. And then for the tape, my hands are now designated as not sterile. Touch the patient. Come over here. Don't worry about, I'm gonna tell y'all to make it easier, but they're broken into little squares. You can kind of see when you hold up to the light. To make this long side fit, you need about 4 squares. This is not a part of checkoff. This is just to make it easier for yourself. And there's no order for placing this on. You just place it on. This is the easiest part of checkoff. Real quick, what happened if a 4x4 was hanging out of here? Watch, Emily, can you grab me a 4x4? It's all the way, the bucket all the way to the right.
You don't tape the top and the bottom because you want it to drain out? Or?
I'm taping the top and the bottom.
Okay.
Sorry. I wanted to show you all this.
No, I didn't know if you did or not.
You're good. Thank you. Okay. So when I flipped it, if one of them was hanging out like this, you don't want to shove it back in, because this area we didn't clean could be promoting more pathogens to get in. You don't really want to pull it out either. What's something you could do?
Paper?
Don't want to tape it either. Good guess, but this is not protecting it from the outside. You'd grab a whole nother 5x9, this blue line, put it on top, try to contain it as much as possible, and then tape around that one. Don't do that. Cool, that's it. Easy, right? Y'all got that. I know it's a lot of steps. Like I said, if you forget something, get a glove. Put this hand next. And a slingshot. It's a lot of steps, but the more you practice it, the better. If you mess up, you just have to recognize yourself to let me know during checkoff, and you'll be fine. See you.
So whenever you are pouring this sterile, say the we still teach that you have to look at it 3 times?
Yes, 3 times. So 3 times. Remember when you're, I don't know if I said it. Thank you, Ms. Young. So when you're in your supply closet and you pick it up for the first time, that's when you're checking your expiration date, make sure it's not torn, things like that. When you go into the room or while you're walking to the room, you can check it then. And your last time of checking is when you're actually opening or going to use the material. Cool. 3 times.
How much would we like pour? Is that just based off of your kind of like what you think?
Yeah, there's no like you need to pour 10 milliliters or it's more just make sure they're wet.
Okay.
Make sure you pour enough to make sure they're wet. And this bottle, the bottles you are using, they're not sterile. They're not actually. We fill them up with faucet water. So when emptying these back out, you can pour the extra that you have back into the bottles or down the sink. And then if you need more, just fill it up in the sink. This is not actual saving. So, alright, cool. Hey guys.